Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Marc Vaughn and Dr. Gwen Vaughn.
And we're live with Dr. Marc Claydon as our guest on our show this week, talking about podiatry.
All the things.
What's podiatry?
Yeah, that's a good question. So, podiatrists are doctors who specialize in foot and ankle trauma, surgery, different conditions. Anything affecting the leg, anything below, we call the tibial tuberosity, which is
should we
anything.
demonstrate?
Yeah, basically anything.
So, right.
Anything basically from there down.
That bump.
Yep. Yeah, exactly. So,
Wow, I didn't know you guys went that far up.
We did. Yeah, we sure do. Yeah, so, a lot of ankle trauma, Achilles ruptures, ankle fractures, bunions, hammer toes, basically anything having to do with, foot and ankle stuff. So, I've been practicing in this area for about 6 years, since 2019.
Yeah, it's been about 6 years now.
Yeah, it's been great.
We've really enjoyed having Dr. Claydon available for our patients.
Yeah, it's been wonderful. Yeah, it's fun collaborating with both Dr. Vaughns over the last couple of years.
You may notice Dr. Gwen is out because his son has a basketball game, but Dr. Claydon is so generous to fill in.
Yeah, no.
And he did get Dutch, for those of you who are curious.
Oh, man.
He did. So these are actually provided by our viewers.
Amazing. Man, this is actually my very first time having Dutch Bros, and it's excellent.
Oh, you've already tried some. Okay.
Yeah, so thank you.
I am enabling the comments to come in through, they're already able through YouTube, and we'll get to those, but also getting it so that we can get them through the other place.
Excellent. Cool. So
Facebook, that's what it's called.
Yeah, that thing.
And I am so sorry. I'm distracted. And you guys know how bad I am about this because you've seen me do this before where I'm trying to find, okay, what's the next thing that Facebook makes you have to do to get the comments coming through? And I apologize greatly that I'm not. Gee.
Well, it's looking good to me. Yeah, you got quite a cool setup going on here.
Yeah,
this
so
is great.
Maybe I'll come back to this, and we should address comments that are coming in. So, comments, we've got, hello, doctors, from Yahtzee 5540. She's one of our regulars. Is it Laura Barzyk, or is it, I'm sorry, I always forget her name. It's so awful.
You're good.
No, here's Laura Barzyk right now.
Chicago.
Hi from Chicago.
Wow.
Laura Barzyk in Chicago. Yahtzee is Bianca from the UK, I believe.
Excellent.
Yeah.
Nice. Wow. All over
So
the
like
place.
I said, or New York. Okay. Yahtzee's from New York.
Excellent.
So you're not Bianca.
Welcome. Hopefully you're staying warm out there.
Okay. Oh my goodness. Yeah. I bet they're having some work for podiatrists with some
Definitely.
ice-related trauma. In that part. Oh my goodness, Lindsay. So Lindsay, topping off the Dutch Bros.
What?
Fun. You gotta give a drink to Lindsay. Thank you, Lindsay.
Yeah, thank you. Man, this is great. I like this.
Thank you, Lindsay. That is very generous. Thank you, Lindsay. Not only Lindsay, but also Laura Barzyk.
Wow.
Yes.
Man.
Oh my goodness. Did they both say the same thing too? It's top off the Dutch Bros Fund for Lindsay, and it's have to refill the Dutch Bros Fund from Laura. Oh my goodness.
Oh man, well thank you.
That is cool. And Yahtzee is indeed freezing in New York. And we apologize for that, but nothing we can do to control it.
We're roughing it out here. I think it's 70 degrees here today? Something like that?
It is warm. I just did a
I don't want to rub it in.
5.6 mile run.
Wow.
Past your office and back.
Amazing. Nice.
Yeah.
Good work.
Yeah.
Man, that's
We
great.
got a little shower right next door, the other side of the wall. So
Yeah,
it'll be
fantastic.
fresh for for you.
You just go right out here on Highway 49, or do you
I
have,
do.
you have a
And
loop
then
that you
out
typically do?
past the airport and up Old Airport and
Beautiful.
come back. Yeah, it really is.
Love
So
it.
you have something new at your office.
I do. Yeah, we got a new MRI going.
MRI at the podiatrist's. Oh, well, it's actually next door, right?
It is. Yeah, we bought the building next door.
Okay.
So,
And this is the Grass Valley office,
It is.
not the Auburn.
correct. Yeah, we have two locations.
I
yeah.
didn't run by the Grass Valley.
You didn't make it that far? It's only like 30 miles. You could do it. You're in great shape.
I didn't do that.
Yeah, for sure.
Okay.
So yeah, we got an extremity MRI up there, which is really cool. Yeah, it's it's about the size of like a front loader, like washer dryer, which is a good size comparison. It's cool because you can just stick your arm into it or your leg, in my case.
So no heads.
So yeah, no, we may be able to. Might be a little stinky.
Would it have to be disembodied?
That is less preferred, but it is possible.
But we could do a head MRI.
Could do a head MRI for sure. Definitely.
Okay. So like if a viewer sent one in and paid cash.
Yeah, I mean, we'd have to look into that for sure.
Like if they wanted to evaluate their recently deceased loved one for CNS disease.
Definitely.
But you don't have a guy who reads head MRIs though.
That's a good question. He's a musculoskeletal radiologist. I'm not sure if he does brain MRIs.
So it's like a local radiologist? Do you have to read your film?
He's actually out of New York. Dr. Hagigi is his name.
Oh, wow.
Yeah. Yeah, okay. He's a musculoskeletal radiologist out there, and yeah, he's fantastic.
Okay. So musculoskeletal, have you had anything other than leg in it yet?
I have, yeah. We've done a couple of wrist and hand MRIs. Yeah, I haven't done a whole lot of elbows yet. We just opened up, what about 2 weeks ago, 3 weeks ago on the 1st. So
who are you getting the patients from for the musculoskeletal stuff that's not your own? Who's referring? Is it people down here?
Yeah, all over the place. Here? Yeah, a lot from Grass Valley, up at Sierra Nevada as well. Some primary care docs up there.
Yeah.
So
yeah, some of them with the last name of Claydon.
Some of the Claydon. We got a couple of Claydons up there.
A couple of primary care?
Yep. Yeah. Okay. Yeah. For those of you that don't know, my dad and my mom and my brother and my sister-in-law are all primary care docs.
Now, the only one I've talked to is her sister-in-law. I don't know if I spoke to her. Maybe it was somebody in her office.
Okay.
We were talking about some SIP stuff.
Yep. Yeah. So we're blessed to get to have the whole family involved in it. And then my wife does a lot of my my medical office billing and front office and back office and whatever is needed.
And
MRI tech. Yeah, she's an extraordinaire. She does a little bit of everything.
In everywhere.
Yeah, she's amazing.
Okay. Well, who's with the kids?
They're actually at Grandma and Grandpa's house right now.
All right.
So, yeah, we have 4 kids. So yeah, my oldest is sick today, unfortunately.
Oh, I'm sorry.
So part of the deal.
Okay.
So yeah, he's a freshman at Nevada Union, and then we got three little ones, and they're hanging out with Grandma and Grandpa right now.
My mom was in the first class at NU.
Okay. No way. Yeah. Man, what year was that?
So she would have graduated from high school in 53, 54.
Okay. Yeah, that was a little while ago. Yeah, I graduated in 2002.
Yeah.
So, yeah, a little bit ahead of me. Not too far.
I think we might have some questions related to podiatry.
Yeah, sure.
So, let's see what we have. We've got, Lindsay saying, Laura, great mind single. Yes, I will agree. Thank you. And Dr. Claydon would too, because he got a Dutch. So
definitely.
Great.
Love it.
Laura, we're having a heat wave. It's going to be in the 20s to 30s next week.
Holy cow.
Definitely beats, is that a minus?
Minus 34?
Oh my goodness. I am so sorry.
Yeah,
we actually Leah and I have been saying a couple times, we are so glad we live here.
Absolutely. Yeah, it's gorgeous out there.
Okay. And this is, who is this? Is that Lindsay? I think she's just doing, oh no, wait. I was just going to say that, Lindsay. Who do I have?
Laura?
Oh, that was Laura, yes. Okay. And then Yahtzee, that is amazing. And the smiley face and Yahtzee. Where did he practice in New York? Or wait, did you say you practiced in New York?
No, my radiologist is from New York.
His radiologist. Yeah. Okay. That's what
it is. No, never practiced in New York. Been there a couple times. Gorgeous.
And then Yahtzee, nice, a medical family. My daughter is a geneticist, my husband a cardiologist, and I am a nurse. And yet you still watch us. I don't ever expect that our audience is going to be a medical family.
Yeah.
That kind of surprises me. But I take it as a great compliment.
They're coming to the right place.
That people who are in the medical field would get something out of our show. So I really appreciate. Thank you.
Definitely. Yeah, no, that's
okay,
fantastic.
So we'll keep an eye out here for like medically related comments or podiatry specifically. But
for sure.
I think one of the questions that we would get from the viewers would be something along the lines of your most interesting case recently.
Yeah.
Today, this week, or last week, this month.
Yeah. Yeah, no, that's
Something
a good
that
question.
stands out that you remember.
Yeah. I do get a lot of ankle fractures. I probably get anywhere from half a dozen to a dozen a week. Ankle fractures.
What?
Get a lot of ankle fractures.
Oh, my goodness.
Yeah.
Now, they're not all going to the OR, are they?
Not all of them. No, probably 3/4 of them do, though. It doesn't take a lot of displacement as far as ankle fractures go. Even if the fracture where it breaks is off by more than 2 millimeters, the whole joint is off by about 50%. You can think of your joint as like kind of locking together, kind of like if you did your knuckles like this. Even if you were to move it over just slightly, that whole joint is off significantly. I'm talking like 50%.
So anything for ambulation, running?
Yeah, all of it. Yes, stability, more in terms of arthritis developing later on. So instead of having a nice joint that's all locked up together, if it shifts off by just a little bit, the only point that's rubbing on that joint is that one little part. And that causes a lot of arthritis later on down the line. So yeah, we have a pretty low threshold for going and fixing those, put some hardware inside there. So it usually consists of plates and screws.
So how many days a week do you operate?
Well, when I'm on call, pretty much every day of the week.
You're in the OR sometimes every day of the week?
Sometimes, yeah. Yeah, I'd say on a typical week, probably 3 or 4 days out of the week, I'm in the OR when I'm on call.
And how many hospitals do you take call for?
2 hospitals.
Oh, my goodness.
Yeah.
Never on call for 2 hospitals at the same time, I would.
No, you gotta make sure. Yeah, you gotta make sure they're not going on at the same time.
Scrub out of one.
You're like, I gotta go.
Drive 30 miles to scrub into.
Yeah, no. So we're here at Sutter Auburn Faith and then Sierra Nevada Memorial Hospital. Which is, we have a really great relationship with
the time
with the orthopedic surgeons around here.
Right. Yes.
Which is been fantastic.
Okay.
So
are there any foot ankle orthopedic surgeons in our area?
So there is one, Dr. Rad Al Sheikh. He actually did his fellowship in foot and ankle surgery. And then
I didn't know that.
Yeah, Dr. Micah Berry, who's up in Grass Valley. Yeah, he did his
Barry's name
in just general orthopedic trauma surgery.
Okay.
And then I believe he did like a 1-year fellowship in foot and ankle surgery.
Barry did.
Yeah,
okay, I'll mention that too.
Yeah, he still does. Yeah, a decent amount of all those things.
Okay. So maybe some of our viewers who aren't from a medical background would kind of be scratching their heads here. It kind of sounds like we're talking about foot and ankle orthopedists who are medical doctors, and quite often doctors of osteopathy go into the same residencies, and then a podiatrist, but it sounds like you're doing the same thing, and they would be right.
Yeah.
There's an overlap there.
Definitely an overlap.
But in addition to doing the surgical, musculoskeletal surgery, podiatrists can also do everything else that the foot has to do with. Now, I don't know if you really do that. You do a lot of surgical stuff, OR. Do you even do much that has to do with skin and toenails?
Yeah, I don't do any, we call it routine foot care.
Foot care.
So if patient, sometimes as we get older, it gets more difficult to cut your toenails, trim calluses and that kind of thing. Yeah, I don't do a whole lot of that.
Okay.
I try to focus more on like surgical type stuff. So ankle replacements, ankle fractures, surgical type stuff, the fun stuff.
Whereas at least one of the podiatrists here in Auburn is kind of the opposite. Is that correct?
Correct. Yeah.
So you guys kind of, do you give stuff to each other? And
Definitely. Okay. Yeah, we have a similar relationship with a couple other podiatrists up in Grass Valley where they like to specialize more in some of the more routine stuff, whereas I like to specialize in more of the surgical stuff. So good relationship with between other podiatrists as well as the orthopedic surgeons, which is a good relationship to have for sure.
Let's see what Yahtzee has to say. What to do when a podiatrist says surgery on a bunion and hammer toe, but orthopedic says no way? Oh, that's interesting.
That is a
little
question.
Controversy there.
Yeah, fantastic question. I would say boil it down to, is it painful?
Okay.
I would say, my general rule for operating pretty much on anything elective, whether it's, an arthritic ankle or a bunion, is say, how much does it hurt? If it's manageable, it's like, it's more cosmetic, I'd say leave it alone.
So you use that word elective. Now, what I'm thinking is, if you can walk out of the office, it's elective. If you're on crutches or in a wheelchair, that would be something that can't wait to elect to have done.
For sure. Yeah, no, that's a great way to put it. Yeah, no, I like that.
Okay.
Yeah, so yeah, in general, if it's cosmetic, doing for most of the, more cosmetic type surgeries, like, well, I don't like the way it looks, is, for any of those surgeries, for most of those are kind of temporary. Usually those bunions will reoccur over time, unless you do something called a fusion, which is actually just removing those joints and putting plates and screws in there to actually grow them together.
Okay.
Anything short of that is typically temporary.
Wow.
So
just shaving or?
Yeah, shaving it down. There's actually 130 documented ways to, fix a bunion, which unfortunately means that there's not really any right way to fix a bunion. It's kind of like whatever works best for that patient. And sometimes that means, just shaving down the prominence. We're like, well, we can buy you 5 or 10 years,
Right.
And sometimes that means, going in and doing an infusion, which, I usually try to reserve those for older folks where you actually go in and fuse the joint because now you can't move your big toe joint anymore.
Oh.
Which in a lot of people, that is arthritic enough that it hurts so much to move. It's like, well, let's just fuse it. And now it doesn't hurt anymore.
How would I miss my big toe moving?
Well, it's interesting.
Giving a thumbs up to people?
You just if you give them the thumbs up sign
with your foot.
Yeah, no, that's the arthritis in particularly in your big toe joint is usually where kind of like wear and tear occurs, kind of like your knees or hips. That happens over decades. So you get to the point where, you should be able to get about 70 degrees at dorsiflexion out your toe, which means you should be able to move your toe up about 70 degrees. And as you get older, that gets less and less until you get to the point where it just doesn't flex at all. Mm-hmm. And if you get to that point, it's like, okay, well, it hurts to move now. Well, let's just remove that joint, put plates and screws in there to hold it in place. Okay. So yeah, no, that's a great question. I'd say, how painful is it? If it's like, it's a little achy at the end of the day, it's not causing you problems, say, live with it. I'd say, if it is super painful, then it's like, well, surgeries, it's a good option. You can take your pain from an 8 out of 10 down to like a 1 or a 2.
Oh, nice. So not 0 though.
We
were hoping for 0.
We always hope for 0. But I'd say with any surgeries, the goal would be to take it from something that's severe to something that's like, well, it's manageable.
Okay.
Like, you guys probably can't see it, but I'm a pretty avid woodworker.
So we've seen your work.
Yeah, so I actually hit my thumb with a router.
Is that what that scar is?
Yeah, I got a little scar going about 5 or 6 years ago. And, it's still kind of, don't have full flexion out of it. Oh. It doesn't really hurt a whole lot anymore, but it did for the first couple of years, kind of annoying and painful. And, even with stuff like that, it's like, got the skin all back together, but it's never going to be perfect.
And you're right-handed?
Yeah, I'm fortunately right-handed.
Are you one of those guys that puts your thumb over the neck to hold the E string down?
For you playing guitar?
Yeah.
What are you talking about? Hey, man, I never picked up playing guitar.
Oh, okay. All right.
But
not an issue.
Yeah.
All right.
Didn't have to worry about it.
Comments here. Yahtzee was talking about your radiologist when she's talking about the doctor in New York. Yeah. And Yahtzee also said, my daughter has bunion surgery called, can you read it?
A lapoplasty. Yeah, those are becoming increasingly popular. I'd say in general with any of those bunion surgeries, kind of like saying if it's not painful, don't worry about it. Your parents are usually a pretty good indication on how severe bunions are going to get. And everybody's got a different opinion on bunion surgeries and all that stuff. But in my case, I say, if you can put off surgery, put it off. Because there's not really any harm in waiting in a lot of cases, till later on. Right. It also depends on the severity of the bunion, if it's limiting daily activities and things. But lapoplasty is kind of the latest and greatest, as far as bunion surgeries go.
Is that a technique you've ever done?
Mm-hmm. Yeah, I've actually done a couple of them, and it's a cool procedure. Okay. And and it has reduced pain and all of the patients that I've done it on. Mm-hmm. But I'd say really base your decisions for surgery, along with your daughter, based on pain.
All right, and then we also have back up. This is Laura saying, I have Raynaud's phenomenon. Hey, I've had that too. And diabetic neuropathy. Oh, man, in my feet. someone recommended acupuncture for foot reflexology to help. Any thoughts?
Yeah. Yeah, no, that's a great question, especially this time of year.
A lot of people are asking.
Yeah, I see a ton of Raynaud's. And all that is what we call a vasospastic condition that typically affects the tips of your fingers and the tips of your toes. And the reason for that is you have this hypersensitivity to cold, and your body is just trying to conserve heat in your core. And what it does is it just shuts down all the peripheral circulation, all the circulation going to your fingers and
where
your
you
toes.
lose a lot of heat.
Yeah, exactly. All of us get that to some extent, where if you get cold, your fingers start turning a little bit purple.
Numb.
Or numb. People with Raynaud's will actually start turning white.
Yeah.
And that white is something called an ischemic condition, which is actually just no blood flow.
Finger stroke.
Yeah.
Fingers recover pretty quickly, though.
Yeah.
It can. How long can you have a tourniquet on an extremity and not worry about damage?
2 hours.
There you go.
Yep. Yeah. So you could actually have that condition for about 2 hours, as long as it doesn't go on to become like frostbite.
Yeah.
Because you're just getting a lack of blood flow, so lack of heat. And that lack of heat, could lead to, really severe condition. It makes you warm up quickly.
And it's the core that has to get warmed up in order for those vessels to open up.
Absolutely.
So core.
Yeah, definitely. Yeah, making sure your core stays warm.
Don't just warm your hands. It's not going to do a job.
Both are very important. Yeah, and if you get on some of the sites online sell like heated vests and like heated gloves, heated socks, all that
Heated
stuff.
enema, yeah. Check first. Make sure it's not too
less effective. But
you think you've spit coffee out before.
Yeah, it warms you up from the inside.
Yeah,
for sure.
yeah.
So your question about acupuncture and reflexology, we see a lot of that stuff, and I get that question every day. And I'd say give it a try. If it helps, go for it. As far as science, there's not a whole lot of science behind it, but there's a lot of things in medicine that we just can't explain. I see patients every day that do, like the red light therapy and, aromatherapy. And they're like, man, this worked perfectly for me. It took away all my symptoms. I say, great.
Good for you.
Very little downside to it. Say, if it helps.
I'm patronizing when I do it. Patting them on the head. Good for you.
Good job.
Yeah.
Nice.
Okay, and let's move on to that. Laura Barzyk says, I like that, Lindsay. The Raynaud's is in both my hands as well, and I'm going with vampire. Okay, that works. Yeah, my whole fingers go dead white. Okay, is that because of Raynaud's, or is that like an emo thing? I never know with Lindsay. And then Yahtzee, perfect answer, ortho versus podiatrist and lapiplasty. Thank you. Oh, you're welcome.
Absolutely. Yeah, great question. Yeah, I get that. I get questions on, should I do surgery every day of the week?
Yep.
Like patients come in with, severe flat foot or arthritis or bunions and hammer toes, and say, does it hurt? Is it causing problems? If the answer is no, say, don't worry about it.
And if it's not hurting now, then it's elective to do something. Mm-hmm. But there may be some things that going ahead and doing a procedure now may help for pain in the future.
Yeah, definitely. Really depending on how severe your parents' condition was.
Okay. My parents died. What's that mean?
Well, yeah, that could be a problem.
I don't think it was from the foot thing.
Yeah, certain conditions, probably the main one that comes to mind is Charcot. Something called,
okay.
Yeah, something called Charcot-Marie-Tooth. This doctor 100 years ago that coined this term, that named it after himself. It's a neurological condition that causes your nerves to just start shutting down.
Yeah.
And it starts with the smallest of the nerves first. And the smallest of the nerves, particularly in your feet and your ankles, are the ones that pull your toes up and keep them kind of straight. Because you can imagine if you're curling your toes, those muscles take a lot of strength to do it, but to pick up your toes off the ground, kind of no big deal. So those bigger muscles need bigger nerves. So the ones that pull up your toes stop firing like they're supposed to, and your toes will, as a result, will start to curl down. Your whole foot starts to turn in. You get this almost like a club foot, which is like, coming in like this. And the earlier the onset is with those, the worse the outcome is later in life.
Oh, so that would be one. Okay.
So that'd be a good one to do is like, okay, well, we got to do some flexor tendon transfers and maybe even cut a little bone, shift it over so that you're still able to walk when you're 30.
Wow. Oh my gosh, just 30.
Yeah.
So we're talking young.
Yeah. The earlier you get it, if you get it in your teens, a lot of those folks are in wheelchairs, by the time they're 30. Wow. If you get diagnosed when you're like 60 or 70, you're like, well, yeah, I mean, if it's taken this long to onset, a lot of times like, okay, well, you got some hammer toes. We'll do a little flexor tenotomy, which means cut the tendon on the bottom of the toe, just kind of straighten it out. That buys us 20 years.
Oh, all right. We also have Laura saying, my family says I'm one of the things that science can't release it. There you go. So there's your reflexology.
Yeah, there you go.
And then Lindsay's saying it definitely fits my aesthetic. Oh, I was talking about her being emo.
That's a good one.
Okay.
Yeah, the white fingers, for sure.
That's really cool.
Yeah.
Any one last thing that comes to mind that you want to share with the intrigued audience on especially the more extravagant experiences of a podiatrist? I guess we should, before we think about that.
Yeah.
But we should talk about training. Where do podiatrists come from? Where do we get them? Are they all from Latvia? I don't know.
Yeah, some of us maybe. Yeah, for sure.
Our audience has watched us for a while. We've talked about college, medical school, residency, and a specialty for medical doctors and osteopathic doctors. But podiatrists, tell us how you got there.
For sure. Yeah, no, that's a great question. So yeah, kind of a similar course to medical doctors. We are DPMs, and DPM starts a Doctor of Podiatric Medicine. What that is, so kind of similar to you guys, we go from high school to undergrad, and then once we finish up our bachelor's degree, we actually take the MCAT, similar to medical doctors, and then but we're specialize in going to podiatry school. There's 9 podiatry schools in the United States. You take the MCAT, apply, kind of similar to medical school. Mm-hmm. That's kind of where we differ is medical doctors go to medical MD schools, whereas podiatrists, we kind of know from the beginning we're going to be foot and ankle surgeons. Mm-hmm. Whereas with medical doctors, you can be primary care doctor or, orthopedic surgeon, kind of like we were talking about earlier. Whereas with us, we know we're going to be specializing in foot and ankle surgery. So we go through
school just for that.
Yeah. So high school, undergrad, 4 years. Podiatry school is also 4 years. And then we apply to residency, which is usually either a 3 or a 4 year program, kind of like you guys do. Go through this thing called the match, and then go to residency for 3 years. A lot of us go on to do fellowships in more specific to doing total ankle replacements and that kind of stuff. So
I did not know that residency was a big, broad thing for podiatrists. I thought it was kind of...
Well, yes and no. Okay. I mean, it's still specific to
everybody.
Every podiatrist now since, I think it was since like 2004, does a residency. Everyone.
I've learned something new.
Yeah.
Okay.
Yeah. So everybody coming out now has some kind of a surgical residency going.
Okay.
There are kind of 2 different types of residencies. It gets complicated. We won't get into it. But yeah, in general, every podiatrist, every podiatry student that comes out now goes to residency.
Have you ever heard of an MD DPM? Somebody who did both.
I know that you can transfer from podiatry school into medical school. Okay. I've never known anyone that's actually done that, though.
I'll tell you why I asked such a weird question.
Yeah.
Because I know MD DDS.
Yeah.
In fact, where I did my residency, everybody who came out of the oral maxillofacial surgery residency was both.
Yeah.
Or nearly, because they had the medical school right there with the dental school. Mm-hmm. And people who were going to go into OMFS would do dental school, get into the residency, and the first 2 years of their residency were the last 2 years with the medical students at the medical school.
Yeah. Yeah, we actually rotated through.
And they get that degree.
Yeah. Yeah. As part of my residency training, we actually rotated through with OMFS, or oral maxillofacial surgery, where we'd get in on these, very complicated cases where these patients have these osteosarcomas.
Foot and mouth disease, right.
Yeah, foot and mouth disease, very complicated. Get these...
That would be complicated. You need a podiatrist with OMFS. So tell me how it goes.
So get these patients that get osteosarcomas of the mandible, which is like jaw cancer. So we do these very complicated surgeries where we actually go in and excise all that bone. And we do is take the fibula, which is a bone in your lower leg, actually excise it, actually remove it from the lower leg, and make them a new jaw out of their leg bone.
And they would have no fibula after?
Well, the middle third of your fibula, I'll just use your ulna as an example. You know, this part of your fibula, you don't need.
Okay.
Yeah, so you can actually just take that whole thing out. Only about 7% of your weight actually goes through the fibula.
Okay.
So you can actually just take that part of your bone out. You need the part around your ankle joint to stabilize it, but that middle third, you don't actually need. So we just take it out, make them a new jaw out of it.
Wow. I'd never heard of this before.
That's pretty cool. Yeah, those are very long surgeries.
Is some kind of a prosthesis put between the proximal and distal ends of the fibula that remains?
Don't need it.
Wow.
Yeah, just take it out.
Okay, so that's why you would work with OMFS. All right.
Yeah. So yeah, we'd get in on the surgeries and go in and take out the fibula and make them a new jaw out of it. Very cool surgeries.
In our comments, somebody got a kick out of the heated enema, and NYU in New York has that. Has one of those programs we discussed, either OMFS or podiatry there.
Yeah, definitely.
Good. Okay, unless you have something you're just dying to get out to potential patients.
Oh yeah, nothing specific. Appreciate you having me.
We put in a full show and went fast.
Man, that
thanks
did go
to
quick.
those comments.
Yeah.
Thank you. And the super chats, those are awesome. Both to Laura and to Lindsay. Thank you so much for that. That was really cool.
Yeah, no, this is great. Yeah, really fantastic questions. And
all right.
Yeah, appreciate you having me.
Well, do you want to come back sometime?
Oh man, I'd love to come back.
Okay.
Tomorrow? Are we doing this tomorrow?
Tomorrow. Let's do it tomorrow.
Doing it tomorrow. Excellent.
And we will still have little clips out daily from our shows. I hope you've enjoyed those. They seem to have been really popular on YouTube. And then the Dr. Vaughn channel, there's a link in the description somewhere for that. You can also see some of the musical stuff I've been doing recently. Give a thumbs up or a like or subscribe. And both this channel and the Dr. Vaughn channel, we found that people get taken off the rolls by YouTube. If you're not watching it for a while, or they have some criteria where they say, oh, that's not a real subscription, and so they'll cut them off.
That's interesting.
You have to make sure you are subscribed. So make sure you are subscribed to the channel. Make sure you have notifications on, because they stopped sending the feed to everybody, even the stuff you like. But thank you. Thanks for joining us. Dr. Marc Claydon. Here, I'll put it up there.
Thanks for tuning in.
Marc Claydon in Grass Valley, California, and Auburn, California. Until next time, this is Dr. Marc Claydon. Dr. Marc Vaughn telling you to stay in good health.